But this book is a reawakening.
Yeah.
It's something that will give you inspiration. It will give you hope that there is something you can do, because there is. We can go back to the grassroots level. We can do what we're doing here in Walnut Creek and start a program for schools and for hospitals and for city facilities where we're serving healthy food to kids and starting exercise programs. And that can start from the top down in Washington too. In fact, they're talking about starting a national program. And I'm saying we've already done it here in Walnut Creek.
Here's a model.
So why don't we capitalize on that model and move forward with that, and with exercise and meaningful purpose, and have people that kind of have an idea of what life is about. This is the guts of a lot of what our book is about, is finding the answers, not just posing the questions and kicking dirt in people's face. So the constructive approach is really what we need to focus on. What can we do to make things better? Is it really hopeless? Are there enough cultural creatives
to pull this off?
Yeah, and I know there are, but we're separate. We're not organized. There isn't any vehicle for us to transform the changes we see are necessary.
I was wondering what you think, Len, about the, it's in the book, but I've always wanted to dialogue more with you about an integrative center like yours, the Health Medicine Center. Is that the model, really, that should be everywhere in the future? Would there be clinics like yours replacing, what we have now in terms of delivery of care? Is that where we're going?
Yes.
Because I think you were alluding to that.
We need to turn the system on its head.
And that would be one way to do it.
Medicine as we know it today will never, ever, ever, ever be primary care. It's invasive care. It comes at a high toll. I mean, there are about 1 million deaths every year. I'm sure we save a lot of lives too, far more than that. But we shouldn't have 1 million deaths. And we wouldn't if we went back to simple lifestyle and the other approaches that I told you should come first. And yes, I think we should work together with many other disciplines. 50% of America has a chronic disease.
They already have it.
Now, no one has solved that problem.
Right.
Not the mainstream, not the complementary and alternative, not the indigenous, not the East, not the West. How about we work together? Isn't that what integrative is about? And pool our resources and see if there's some kind of synergy that we can come to that will make healthcare everywhere better. And then to try and do it on a personal level, because let's face it, physical disease is the body's way of expressing psychospiritual dysfunction. And we all but ignore that in the mainstream. It's like, get people well, get them back to work, do it at the lowest cost you can, and everybody will be happy. Well, here we are, and we're not happy, and we haven't solved the problem. And we're talking now about having insurance that will be something that is at the national level, whether it's single payer or it's privatized or whatever it is. Who cares? I mean, yes, we all deserve health care, and actually we're all getting it now one way or another, but at a price we can't afford. But it's not health care. It's disease care. So we have to shift this whole way of looking at things to those standards.
The book ends on the note of saying that single-payer, so-called single-payer insurance, national universal insurance, Medicare for everyone, is necessary but not sufficient.
That's right. There's so many more things in the book that I think people are going to appreciate. That look at the details of what is going on in America. It looks at big pharma, the FDA, the Congress, and how it's not really serving the people as it should. It's looking at medical education, and then of course bringing the new system to the table. So this book, A Return to Healing, really is about radical healthcare reform and the future of medicine. And it's something that if we focus on carefully and we all pay attention to the things that are in this book, it gives us the nucleus from which we can transform socially how Americans live, not just in the realm of medicine, but in every area: business, law, medicine, science, religion, etc.